We're all different. We don't look the same, believe the same things, feel the same way. Our gifts, voices, views are all unique and impact how we learn, achieve, and interact with others. At Duke University and Duke Health, we embrace differences among all people and aim to foster a diverse and inclusive community where our employees are always valued, respected, and supported.
Diversity and inclusion to me, at a personal level, is really about people. In our organization, our mission is connected to how we bring people together from diverse backgrounds and nurture them to work in pursuit of a shared vision.
At Duke, we're all about assembling diverse populations of people who bring special talents and interests to the table. And the more we learn from each other, the more we actively work with each other, whether in a research lab, delivering clinical care to our patients, serving the needs of our students, the better we will be. Teamwork is absolutely essential to the work of a great university.
To do our best, it's important that we understand the value of diversity and how it fits into the work we do each and every day.
My view of diversity is that it's a combination of lived experience and identity, and how those things affect the way one moves through the world. So identity being things like your race, your sex, sexual orientation, are what we describe as protected categories, combined with where or how you were raised, your socioeconomic status, what part of the country you come from, all impact how you work and learn here at Duke. So our shared goal is to embrace diversity and foster a climate where we all thrive and can bring our best selves in order to achieve excellence.
I believe that diversity is more about what's your vantage point in life? Where do you come from? Who are you? What do you believe? How have you been raised?
I think of diversity as every way that an individual exists in the world.
And the way you exist in the world impacts not only your coworkers, but also the students, patients, and their families that we serve.
The Duke Child and Adolescent Gender Care Clinic serves children who are struggling with their gender identity. We provide support, treatment, access to resources, access to medical care. This is a unique population, and they have a lot of needs, just people that understand them and will advocate for them and affirm who they are. I may not be transitioning the way some of these kids are, but I see in them my story in a lot of ways. I've felt the discrimination that they felt. I came out at 19 years old in college. It was a very difficult process for me. I was really afraid to tell anybody. Knowing that somebody understands is huge. I've been out as gay since I started here. I've just always felt like this is a safe professional environment to be in. This clinic is part of a bigger conversation. I'm part of an interdisciplinary team. You get to hear different perspectives. If we're really going to value diversity, you have to open your doors to everybody, not just a certain population. And every population has unique needs. It's no different with the LGBT community. So if a person doesn't feel safe telling somebody their status, their gender identity, or their sexual orientation, the provider is going to miss a lot of important information, important to their care. I think when every voice is heard, it not only enriches the conversation, but it brings new ideas to the table. Getting to hear the other perspective, I think, is what makes this institution great.
We have students from all over the country, from all over the world here, and our role is to really truly educate them. And we don't really want there to be barriers to their education where they feel they're not comfortable here. We want all the students who come to Duke, regardless of background, to feel that they're full participants in the community and that everything at Duke is available and open to them.
We serve a very diverse patient population. Delivering the very best health care possible confronts a lot of challenges every day. We serve that patient population better if we have a diverse team of caretakers taking care of them. They bring a broader understanding to the table. They bring perhaps an appreciation of culture.
My family story is that I was actually born in Vietnam, South Vietnam. My dad was the captain of the boat that escaped Vietnam. We went to a refugee camp in Malaysia, and then we were sponsored by a church in Massachusetts. There was only just a handful of Asian families in the whole city. It was a very white community and a very wealthy community, so we were, not wealthy and we were not white. In terms of differences, what we would eat for breakfast was way different than what my friends would eat for breakfast. When my friends would come over, they would be like, what's that, a shrine? Because we're Buddhist. Their teachings, just being kind and just giving back to the community, I think is what shaped me to want to become a social worker. I think it's our personal and professional charge to get to know people for the many layers that they are, what their preferences are, what their history is, their cultural understanding of medicines, of pain, of end of life. I think that's where it starts. The intention of wanting to hear another person's story and then respecting, that story, I think is fundamental.
The world's increasing globalization requires more understanding and acceptance of the beliefs, values, and ethics of others, and the skills necessary to work with and serve diverse individuals and groups. At Duke, we're aiming to help our employees grow in cultural competence. Consider this. The brain categorizes people by race in the first 1/5 of a second after seeing a face. To advance, it's important that we begin to understand the role of implicit and explicit bias.
I grew up in a segregated community in Houston, Texas, where I went to segregated school all the way through high school. So it was explicit. And it wasn't until later that I encountered what would be considered today implicit bias. As an African-American student going on rounds, I was greeted differently and I was treated differently by attending staff and in some cases by the patients that I interacted with. So I've had personal experience with it and believe that it exists. At the same time, I believe that we all have a responsibility to get it in the open.
Explicit bias is overt, so I don't like working with people who come from Idaho. Things that you openly understand are a preference and that you consciously endorse. Implicit bias, on the other hand, occurs as a result of a subtle cognitive process that operates below the surface and is not conscious. So implicit bias can be damaging because it might work against your intentional goals.
What does implicit bias look like? In one study, a man and a woman teach 2 sessions of an online class. Both teach one session using a male name and the other session using a female name. They teach the classes identically.
At the end of the semester, they ask the students to rate the professors and the class, and the male names get rated significantly better, and it really indicates the power of gender in our culture.
Here's another example to consider. When you see this word, overweight, what stereotype do you associate with it? Energetic or lazy? If you're like most people, you said lazy.
Bias or subtle unconscious attitudes about others, not just as it relates to weight, but any identity or even someone's name, can result in lost opportunities. All kinds of people bring value, and it's sometimes not packaged in ways we expect. As we strive for excellence, which we know is more achievable if we invite a variety of perspectives and social identities, we want to resist bias and embrace diversity.
Everybody has bias. It's not a shaming thing. It's okay that you have bias. It's not okay if you don't examine it and do something about it.
Implicit bias has even been shown to impact the quality of health care a patient receives based on their race, ethnicity, gender, or other characteristics.
Patient care is about being patient-centered. I'm often asked, what do you think is the most important thing to being a very effective physician or a nurse or a pharmacist or a healthcare provider? And I say empathy. And empathy by definition means that you can put yourself in that individual's seat or bed or position, and it cuts to the core of our mission. Advancing health together means that we're going to rely on each individual to do his or her part to ensure that we extract every ounce of talent out of every individual in our organization to the benefit of the people in the communities we serve.
Under my purview, particularly, I'm interested in enhancing faculty diversity. A team that brings a diversity of views to problem solving is going to be much more successful in the long run.
Research shows that sensitivity to diversity and awareness of explicit and implicit bias can lead to greater creativity, higher productivity, and successful outcomes. Both Duke Health and Duke University offer diversity and inclusion workshops and training to employees.
It made the team stronger, and it also led us sort of to acknowledge to ourselves and to others that, first of all, obviously we all have different perspectives, but also that we acknowledge that our perspective may be flawed, and I think that opens the door to even broader dialogue.
I would encourage every member of the Duke community to attend the programs that we've developed to help understand what it takes to be a diverse and inclusive community. It takes time, it takes attention to make sure that every member of our community feels at home here at Duke.
It taught me a lot about myself. It helped me understand how I could improve in caring for patients who were different than me. Once you finish the diversity training, that's just the start of what you need to do. You need to stay in conversation with your colleagues and your managers and your leaders.
Our students love to dance. Some of those dance groups are very specific in terms of cultures and the music that they identify with. Go to a performance. There are also cultural centers, and those centers also put on various programming and events throughout the year. So take time out of your schedule and check it out.
Duke employs more than 36,000 people, but you're not a number to us. You're an individual with your own history, beliefs, and perspective. No matter your job, you, as a human being, are central to uplifting our organization's mission, vision, and values. And diversity is a value we hold in the highest regard.
Project Search is a really special collaboration that we have that includes numerous community partners. It's Duke Regional Hospital and the health system, it's Durham Public Schools, it's Alliance Behavioral Health, Vocational Rehab, and OE Enterprises, where we bring senior high school students from Durham Public Schools who have developmental disabilities, and they come into our hospital, spend the entire academic year here, and then they go out and do internships in the hospital. So they're learning real life job skills and getting that on-the-job training. So we've had, I believe, 38 students go through the program so far. About half of them are now employed somewhere in our community, some of them right here at Duke Regional.
My teacher talked to Brian, let Brian know I need a job. They do train me. I do that job because I did not know I'd do it, so one day help me out.
Devontae's been employed with us for a few years now.
The employees that we have in our department from Project Search come in, they punch the clock just like everyone else. We've now been able to hire 3 individuals into our department. We've found that they are extremely dependable. They show up on time, and they're just very eager to fulfill their day-to-day goals. All they want to do is contribute, have a paycheck, and be part of a family, and that's really what we're doing here.
We're all human. It's a way we give back, but we get more than we ever give back. It's part of the work that we're doing on building a culture of inclusion and respect in our organization. But what I don't think any of us anticipated was the positive impact it would have on our entire team here.
When I was a graduate student here, I was taking something called my qualifying exam, and I was, at that point in time, going to be the first African American to pass that exam in the neurobiology department here at Duke. But I remember about halfway through this 3-hour exam, I went outside to take a break, and all of the housekeepers who worked in that building were outside of the room. I asked them, "What are you doing here? I thought you all got off at 3 o'clock." And they said, "We are holding you down. We are staying here until you pass," making me tear up a little. They said, "We're staying here until we're sure you passed." I can't do my job without them. And I think that the idea that any of us are sort of exempt from needing to celebrate one another, our similarities, our differences, is not true, because we all need each other to be successful here.
The last line of the Duke Statement of Commitment of Diversity and Inclusion says that all members of our community have a responsibility to uphold these values. And I think this is a critical concept because we all have a role to play in creating and maintaining a supportive and diverse university community. This is everyone's work.
Duke University can feel proud of what we've done to create a diverse, inclusive, and welcoming community, but we have much more to do. We want to be ambitious in creating an exemplar of what our society can become. That means making sure that every member of the Duke community feels valued and is a part of the team.
When I think about diversity and inclusion, a word that comes to mind is journey. And this is a journey. It really does start with you.
By respecting and valuing all of our colleagues for who they are and what they uniquely bring to the conversation. By recognizing that we're all human beings with biases, but with a willingness to learn more, to be more, we can continue to evolve and grow, embracing our differences and celebrating our common goal to teach, treat, and positively benefit the communities that we proudly serve.